Dr. Leonard from Central Ohio Spine and Joint, and in this video today I wanted to talk about a term that we use pretty much every single day within our office, and that is the term directional preference. When a patient comes into us either complaining of neck pain or back pain, the first thing that we try to do, purely based on what they're describing to us, is try to create a directional preference. A lot of times patients will come in and say certain positions either make their pain feel better or make their pain feel worse. And based on that description, it allows us to narrow our focus a little bit more on potentially what's causing their pain. So what I wanted to do today was just kind of show you here on the spine model certain positions and what type of stress that plays on the spine itself. So if we look at the spine model here, this is essentially the front or your belly, this would be your back here. So the two positions that we talk the most about would be flexion or extension, okay? So flexion position is where essentially we're bending forward. That would be positions like bending forward at the waist, tying your shoes, or even sitting down throughout the day. So when we flex forward or bend forward, it does a couple things. Number one is it creates a little bit of mechanical compression to the front part of this disc, which a lot of times will actually create a little bit more bulging to that disc itself. So patients that are dealing with some type of disc bulge or disc herniation, typically flexion positions or sitting seem to be more painful. On the opposite end of that is positions that create extension, where we're extending back. Those are positions like walking, laying down, being upright. They tend to create a lot of compression to these joints in the back here, as well as they have an effect on the canals where the nerves come out. So a common condition where we see extension being a problem is what we would term stenosis. Stenosis is a fancy term for just narrowing of this canal or narrowing of one of the central canals. And when we go into positions like extension, like standing upright, it tends to actually narrow that canal even more. These are the patients that you hear have trouble walking for prolonged periods of time, have trouble standing at the sink, and when they bend over at the waist, it actually creates a little bit of relief for them. So purely based on this information, we utilize this to integrate exercises and treatment for positions that actually give you relief. So if sitting is really hard for you, creates back pain and leg pain, but standing upright or extending feels better, we tend to incorporate more exercises that introduce extension into the spine. On the opposite end, if you know that you're upright walking around and pain just sears down your leg or in your back, we tend to use positions where we're bent forward to try to open up those canals a little bit more. So again, purely based on the information that our patients provide us with positions that either make them feel better or worse, we're able to dictate our treatment, dictate potentially where that pain is coming from. So think about yourself, think about whether you have a directional preference or not. If you have any questions, please leave a comment and make sure to share and like this video, and we'll see you guys next time. Thanks.